Dental implants is basically a replacement for the root of teeth. And so if you could imagine, your tooth is made of two parts, the part that's sticking out of the gum and the part that's below the gum. So an implant replaces the part that is below the gum. And the advantage of that over, say, for instance, a denture is it's almost, I can't even imagine having a denture if it were me, if it were my mouth, knowing the difference between the two. Because with implants, we can actually give patients back all of their biting strength. We can give them back kind of the feel of their palate and their ability to taste. It's just a wonderful technology. We can now reverse engineer our implant placement such that the implant is always going to go exactly where it needs to go relative to the tooth on top of it. And we're going to avoid any nerves, we're going to avoid damaging the adjacent teeth, and we're going to have a really good long-term outcome. Essentially, that again, the goal is to have a tooth replacement that no one knows is a tooth replacement. You hear a lot today about teeth in a day. While sometimes that is possible and sometimes that's even the best way, it rarely is. And what I would say is it'd be much better to have teeth for a lifetime. And if having teeth for a lifetime means you have to take, say, 3 to 6 months to get there, it's certainly worth that investment of time. Anybody who's missing teeth is a good candidate for dental implants unless there's not a sufficient volume of bone to place an implant. Recovering from any surgery, of course, you're going to have swelling, you're going to have pain. There are times when patients, they have almost no pain and they go back to work the same day. Sometimes when it's a more involved case, and we do have to reflect soft tissues or site create, then it's a little more involved. But in terms of the post-operative course, it's usually quite short and really not that uncomfortable. The benefits, I believe, for implants, say, versus the older technologies that we had for replacing teeth, is again this idea that every tooth has its own legs. And so that any future problem is not a multi-tooth problem, it's a single tooth problem. That's number one. Number two, because each of the teeth are separate, you can floss between them versus, say, a bridge where you cannot floss between them. So keeping your teeth clean and therefore keeping them healthy is a much easier task when you have implants versus, say, some of the older technologies, a bridge or a partial denture, etc.